It's been hard getting to the truth about health care reform.
Sometimes you don't know what to believe.
Especially for millions of us who are on Medicare.
Over the past year, seniors found themselves at the center of an often contentious health care debate. Many were worried that Medicare would be used as a piggy bank to pay for national health care reform. As president of the National Committee to Preserve Social Security and Medicare, and a former member of Congress, I can tell you, I worried about that too. In fact, I traveled around the nation talking about health care reform and how important it was that Medicare emerge stronger, not weaker. I'm happy to report Congress did just that. Medicare will be stronger thanks to health care reform. But don't just take my word for it. You can see for yourself why senior advocates believe this bill is the most beneficial reform to Medicare since its creation.
There are three key ways in which healthcare reform improves Medicare and helps the American seniors it serves. First, it strengthens Medicare's fiscal health by more than doubling its trust fund solvency, slowing cost growth and ultimately saving $450 billion over the next decade. Your access to doctors is preserved, but we still need a permanent fix to the doctor reimbursement issue.
Even if you aren't comfortable doing it, you will feel here.
And it's very expensive to stay healthy.
Medicare is something that is very important in our lives.
Without the coverage, most people in retirement can't afford it.
And that's why the status quo just wasn't an option for Medicare. Without reform to slow the rate of growth of health care costs system-wide, Medicare, as the nation's largest government health care program, would have faced unprecedented cuts. Simply put, our nation can't afford a health care system with uncontrolled cost growth. Those high costs impact every American who's paying for health care, young and old alike. In the case of Medicare, rising costs were predicted to balloon spending from 14% of the federal budget now to 67% by the year 2080. Healthcare reform will change that.
That's why so many in the aging community and senior advocates ultimately supported this health care reform bill. Is it perfect? No, it's not. But we now have a reform foundation that can be built on. We are starting out strong with all the provisions that seniors will benefit from in just the first year, like beginning to close the Part D donut hole.
I mean, who can afford to wake up one morning to find out they no longer have prescription drug coverage? It's crazy.
The donut hole was an idea only insurers could love.
So if we could get rid of the donut hole, it would just be a big step toward better health care.
And that's just what this health reform bill does. Through rebates and discounts, seniors will see donut hole savings as soon as next year. What this reform will ultimately do is put real health care dollars back into the pockets of seniors who need them, and not to the insurers who've profited for years from this flawed provision. But there are other important changes to Part D too, such as improving low-income seniors' access to plans with zero premiums, and to important classes of drugs like anti-cancer drugs and immunosuppressants. And there will be new penalties for companies who target seniors with misleading or false marketing campaigns, trying to enroll them in their Part D plans.
If you'd asked me a few years ago if Congress would close the donut hole, my answer would have been no. But here we are celebrating exactly that. Not only did they close the donut hole, but Congress added over a decade of solvency to Medicare at the same time. Not to mention the many other needed reforms included in this legislation that will improve care for America's seniors.
Reform will keep seniors healthier by increasing access to preventive care through the elimination of copays and expanding prevention services. There are incentives for better care coordination and reducing hospital readmissions. Seniors will soon see and feel the positive impact of health care reform improvements as they manage activities related to their own health and well-being. In addition to doubling Medicare solvency, improving access to care, closing the donut hole, and numerous other Part D reforms, there are many additional benefits in health care reform. So many, we can only show you some of them here.
So many seniors have said to me, how can taking almost $500 billion in savings from the Medicare program be a good thing? I understand the confusion, but the truth of the matter is those savings aren't coming from beneficiaries. They're rate reductions that providers agreed to early in the health care debate. The hospitals, home health services, nursing homes, and drug makers knew that the status quo was not an option in Medicare. They knew they must provide more efficient, cost-effective care for our seniors.
Which leads us to Medicare Advantage plans. Private MA insurers charge 13% more to cover their enrollees than it costs to cover seniors in traditional Medicare. Those costs are paid by every single senior in Medicare, whether you're in a private plan or not. By keeping payments level next year and phasing out the overpayments over time, these billions in subsidies to private insurers will be virtually eliminated. Some of those savings will be reinvested back into the Medicare program, reducing Part B premiums for everyone. While some private MA insurers have threatened to cut benefits once these overpayments are eliminated, this health care reform legislation offers protection for Medicare Advantage beneficiaries, including MA plans must provide the same benefits that beneficiaries in traditional Medicare receive. And they can't charge more for expensive services like chemotherapy, skilled nursing care, and renal dialysis. And healthcare reform requires the Medicare Advantage plans spend more of their money on patients, not profits or overhead.
Medicare has been protecting the health and well-being of our nation's older citizens. While Medicare has saved millions of seniors from financial destitution and medical desperation, it has been subject to the same market pressures as any other healthcare system. Something had to be done to ensure that the coverage we all depend on would continue. Without reform, Medicare wouldn't survive. It's just that simple. These new reforms strengthen Medicare while helping seniors stay healthier longer. It's a Medicare success story we all should be celebrating.
We need a strong Medicare program.
Seniors need drug coverage that works.
Healthcare reform will strengthen Medicare. That's good news for me, because I hope to be around a lot longer.